Hello guys, today we have an amazing video for you. We are about to talk about how an African American was able to build a very nice health facility for a community in the central region. We need to speak about it. This is what we need to promote about Africa, and we are here to talk about it.
Welcome to Ayawa Safie. My name is Zakia Penny, and I am Director, CEO, and this facility is owned by my parents.
So, what really inspired you guys to build this very beautiful facilities for this community?
Okay, thank you. We were inspired to build this facility because this community needs it. At the time we started construction, there was no healthcare facility in the area. Since we have started building, there's now a CHIPS compound at Ensadra. But when we started, there was no health facility unless Kisi or Elmina Polyclinic. So most of us walk in this community. It's a fishing village and a fishing community. So it was needed in this area. So we said, let's build one for the community.
Well, I would like you to show me around.
So please, let's start here briefly. Sorry. This is our triage area. This is Nurse Christie. This is our waiting area. We have a children's play area with blocks and things to keep the children busy. We can start here. This is our consulting room. This is our consulting room with Doc Claytis.
Oh, okay. Oh, Doc. Yeah. Congratulations for helping our sister to achieve this very beautiful hospital for this very beautiful community.
Thank you so much. Thank you.
We are coming.
Okay.
So after the consulting room, we have our ward. It's a four bed ward. If we have to detain someone, we detain them here. Maybe if they have malaria or dehydrated or something like that, we will detain the patient here. If women give birth, we keep them for at least 12 hours. So those are some of the uses of the ward. So we have
well, you can just
okay. So we have this just for privacy. We have our oxygen in case we need, and we have another bed here and our supplies behind this screen. So it is still a work in progress, but at least we have everything we need for wound dressing, for line setting, IVs, and all that.
Okay.
Yeah.
Well, in this very community, I still want to ask certain things. You establishing these health facilities, what did you really consider before establishing it?
Okay, what we considered is our main concerns in this area. What is needed? What are the more popular infections and issues that we have in this area? So we actually started with doing free health fairs in 2012 in conjunction with UCC, Anchor for nursing students, and Dr. Morna, which is a very popular physician in the Cape Coast area. So those are some of the people that we worked with, and we actually started doing free health fairs, as I said, in 2012. So we gathered our information and our data from doing the free health screenings and say, okay, for our facility, we need to have midwives. We need to be able to do at least something small in each area so we can try to help our community.
Wow. So tell me about this Sabayet.
Okay, so Sabayet is the name of our community center in our hometown of St. Louis, Missouri. It's actually an African-centered community center, and the word Sabayet means purveyor of wisdom or wisdom teachers. And it's a Kemetic word or an Egyptian word. And so when we did our first health fair in 2012, we named it Sabayet Health and Wellness Clinic.
So it was really successful, right?
Yes,
oh, okay.
very successful. We actually saw over 4,000 people in the surrounding communities.
Wow.
Yes.
That's amazing.
Thank you.
4,000.
Yes.
Guys, we need to support. Even though she's doing it, but she can't do it all alone. We need more support. She needs me, I need her. You watching me too, you need her, she needs you. So let's do it together. Let's make sure we build this together, because we need to build Africa to our liking. We need to build Africa to what we want it to be. We shouldn't joke with African development. So what are some of the things that, when it comes to health issues, what are some of the problems that you guys have been seeing, and what are some of the things that you've been solving for people over here in this community?
Okay, so I would say that hygiene, sanitary hygiene, respiratory infections are common, malaria is common, normal body aches and pains are very common. Hernia is also very common in our area, and uh, just common colds.
Wow. So apart from those things, you don't add any other services to?
Oh, we do. We have preventative services. We actually work with traditional herbalists and traditional practitioners as well to try to incorporate what we believe in culturally with the Orthodox medicine. So we do. Uh, it's an integrated health facility.
Yeah.
So we do that, and we have midwife services. We have delivered babies here, which is very popular in the villages, of course. There's a lot of babies being born. So we do a little bit of everything.
Well, I'm really impressed with what I'm seeing now. Guys, let me tell you, this is what we have to be promoting in Africa. Some people has kept quiet not to promote what this very beautiful lady is doing. We need to help her, we need to promote her to establish more things in Ghana. Buying land or maybe acquiring land and then building this very beautiful facility on it. How has it been? Was it difficult? Was it easy?
Okay. No, it was not easy. Um, it wasn't easy at all. By us coming from US and us being foreigners, my parents, it wasn't easy. Uh, my father came with an idea of buying one plot of land, but he ended up buying 15 acres. And so we had to go through the normal bumps and challenges. Buying the land several times. The land was not developed. There was no electricity. There was no water. There was no infrastructure. It was totally bush. And so my parents had to get it cleared. We had to put roads in. We had to put in the light poles for electricity. We had to get water. So everything we had to do ourselves, you know. So it was a process, and we like to say it was our initiation to Ghana. We didn't give up. We persevered, and it's something that my parents are very passionate about. They brought everything they worked so hard for in the US for 30 plus years, and they brought it here in Ghana and invested in Ghana. You know, I would like to say that unlike a lot of Americans and a lot of African Americans, we didn't come here to, oh, look how big my house is. Look how, you know,
Wow.
it's nothing wrong with
Yeah.
that. But I'm just saying that's not our story. We
Yeah.
didn't come here
Your story is very different.
Thank you.
You came to help the people.
Yes,
you
we
came to
came
help
to help.
Africa.
We came to help. We didn't come, even in the US, we are not the kind of people to buy new cars every year or just to spend money. We come from a background of helping our community and helping our brothers and sisters. So we had that same mindset coming to Ghana.
Well, achieving this, I would say you are a legend in Ghana precisely because this is really my first time. I've been hearing things about African Americans doing so many things in Ghana, but this is really my first time seeing somebody like you building a very good health facility for a community freely
Thank you.
for them. Well, I've seen a whole lot of buildings, the minor surgery,
Yes.
and so forth. Maybe if you like to walk me around to see
Okay.
yeah.
Okay. So this is washrooms
Oh, okay.
for patients and clients,
Yeah.
male, female. We have washroom for staff. This large open area I like to call our training area. We
Okay.
have extra exam tables. We have dental chairs and extra items we have. And I have had people from the Red Cross to come and do CPR training and just uh, training on how other cultures do other things so we can incorporate what we do here in Ghana with other health practitioners. So this is our training area. This way is our front office, and we have Justina here. So this is where we keep our medical records. Our cashier and everything is in this area. We have our something unique. We have
Yeah.
our gifts that we give to new
Okay, so
patients.
oh wow, then I'll take this one away. I'll take this one away.
If we have new patients that come and it's their first time, we give a small health gift bag with, some health items in there. And we also have our dispensary, our pharmacy that is right next door. I don't know if you want to go inside. Thank you.
Camera.
Someone's trying to
Oh,
hide.
someone is hiding. Someone is hiding.
So we have Madame Dorothy here, and we have mostly the drugs and the medicines that we use.
Okay.
We have our more serious injections and IV fluids and things we have in our cabinet. So this is our pharmacy.
Wow, that's so amazing. It's very, very amazing. I just want to know, building this place, there might be challenges.
Yes.
Did you ever face any challenge, or would you like to share some of the challenges that you faced so far when
Okay.
building this place?
Yes. So we had challenges with a little bit from the government, from Ghana Health Service, because we are a private facility. We've had some challenges with uh, our community is not a wealthy community. It's not Elmina or Cape Coast. So there's a challenge with people being able to pay. So we work with everyone. We don't turn anyone away. Even if you don't have the money, we still will provide services and do our very best. Other than that, we've been well accepted with the community, and everyone has really has accepted us with open arms.
Well, so how well is the community reacting to this very health facility over here?
So it is our community, our immediate community that supports us. So for the most part, they are very receptive and very accepting of us and of the facility. So.
Well, I realize that you have some staffs over here. So I just want to ask, how many staffs do you have over here in this very facility?
Okay, so we have 6 staff members.
Okay.
We have someone that is out on maternity leave, but we have our physician assistant, we have our medical scientists, we have midwife, we have nurses, and we have our person at the front desk.
Well, I need to ask a very curious question about
Yes.
this. How much did you spend to build this whole facility?
Oh, Okay. So this facility honestly was more than I would say. Now my father isn't here. He's the one spending the money. But I would say the facility was over, just knowing what I know, it was over $100,000
Wow,
that we spent on this facility
that's
because
much.
we spent a lot, and as I said, it took us 10 good years to build it.
10
Um,
years.
10 years because we don't have any sponsorships, we don't have any grants, no loans, no nothing. My parents did it from their pockets. So as they got money, they used their money and built it little by little by little. And the foundation, I know, it took us 3 years just to complete the foundation because it was very expensive. The foundation was about 20,000. I would say 20,000 CDs just for the foundation, filling it, building it, and I will have to take the blame because my father says, "Oh, we just need something small for the community, maybe 1 or 2 rooms." And so I came up with this. He said, "Oh, this is not what
Yeah,
I
because
told you to do."
20,000 cities is
Mm,
just something small for
yes,
this.
yes. So, um, but I felt like we have a little bit of what we need. So.
So, have you perchance had any patients that you refer him to any other person or any other big hospitals and so forth?
Yes, please. If we are not, there's only so much we can do under our medical license. And so if it's something that we cannot handle here, we will stabilize the patient and refer them to Elmina Polyclinic. We can't refer straight to Etibetan or something like that. So we have to refer to the nearest hospital first. And Kissy is not a hospital, it's a health center as well. So we can't refer to another health center. So the polyclinic is the closest facility to us.
Well, I'll need to ask you one personal question.
Yes,
Being an African American
yes,
or a diaspora, owning this very beautiful health facility in Ghana
yes.
and also in Ghana community as well, how does it make you feel?
I feel so good. I feel so honored to be in Ghana. I love Ghana. I love Africa. And so I feel very honored to have the resources to be able to help. So I feel so good. I love what I'm doing. I love coming to work. I love the staff. I have an exceptional staff, and I feel like we have an exceptional facility here.
But do you have any field in the health sector?
I do not. I will say I have a bachelor's in biology, so I am a biologist by my schooling. But I don't really have any experience other than my biology degree in the health industry. I'm just learning as I go. I ask for advice and collaborate with different people, and I'm learning as I go.
Well, way back when I heard of biology, I thought killing chicken or maybe dogs and so forth, naming those parts in their sex organs and so forth. That is what I
Yes,
only thought of biology. But I
yes.
never knew that biology was a big thing that we might be using it in our day-to-day activities and so forth.
Mhm.
Well, getting license on this very facility, was it difficult? How does it?
Um, I think anyone that has a health license, private facility or even government facility knows it's not easy. It's not easy at all to get your license from HEFRA and all you have to have fire permit, inspection, environmental, sanitation, all this. So there's a lot of steps, and it's not easy by any means. And it took us probably 1 good year to get all of our licenses. So it's not easy, it's not cheap, it's expensive, but it's something that we needed. We wanted to have everything in order, and we wanted to do everything legally.
Well, I'd like you to show me
Okay.
around more places that we have.
Okay.
And another thing that I also want to ask is maintaining this very place.
Hmm.
This place, you guys have invested so many in this very place. So
Hmm.
maintaining it, how do you guys manage to maintain this? Beautiful place.
You know, right now, the staff helps, and I myself help to maintain it. With it being a health center, hygiene and a sanitary environment is very, very important. So we all work together to maintain the community. And we also have people in the community that we employ that also help as far as the mowing the grass and
Yeah.
just the general upkeep of the facility.
Oh wow. I can see you are sweating, so I think you need to get to a place that you feel the air
Oh, it's
conditioning.
okay. It's okay. It's normal. It's normal. It's normal.
No, you're in a health facility, so at least I need to make sure you are safe.
Okay. So please, this is our minor surgery
Oh,
room.
okay.
So we are still getting things and still working on getting the items that we need, of course. But we have our portable procedure table where we can put IV. We can weigh patients on this. We have our surgical tools. We have a defibrillator. We have a portable EKG machine. So we have some things. We are still in process getting more.
Well, you made mention of you still need more staff to
Yes.
um, make sure this place is okay, or maybe this place is set. Would you mind if the government want to intervene to partner with you to work together?
I don't mind, but I would be very specific about certain things. It depends because, sometimes when you work closer with government or things like that, they have certain things that they want you to do, and we want to control as best as we can. We want to control what we do and how we do it without too much interference. Of course, if it's positive, then that's different, but we want to be able to control our own destiny and to be able to run the facility.
Well, I need to see the outside
Okay.
of the place too to know how it looks like because you're always inside.
Oh, but we have,
Yeah.
sorry, we have more rooms.
All right, so you can show me around. Listen.
So let's start.
Yeah.
We are almost done.
Oh, okay.
This is our antenatal room. We have our
Wow.
bassinets where we put our babies.
Okay.
We have birthing stools and we have tables where the ladies give birth.
Oh,
So
amazing.
yes,
So
so
you are just like everything is inclusive at this very place. You
yes,
can do everything.
yes.
So just in case I get my wife pregnant, she
Oh,
can come
she
here.
can come here and deliver. She can come here and deliver. So
Well,
this is our
staff only.
staff lounge
Oh, okay.
where we
So
have
nobody
our
can enter.
no, where we have our lunches,
Yeah.
we have our meetings, the staff eats and takes their
Your press
breaks.
conferences and so forth.
And then this is the last room. This is our lab.
Oh, okay. The herbal medicine.
Yes,
That's a lab.
it's a combination. This is our lab. This is Bismarck, who you were speaking
Oh,
to.
okay.
We have our blood drawing chair. We have our centrifuge, our microscope, and our uh, Bismarck. Help me.
Yeah, so we have some of the test kits of any of the labs and all that's here. So we do from malaria tests, typhoid tests, H. pylori test, sickle cell test, blood grouping test, urinary test, pregnancy test, full blood counts, and a whole lot.
Well, guys, we do all the tests, all the necessary tests, even HIV, we do it. So even if you are having HIV, just come. We'll do the HIV test for you. We'll make sure all the HIV is gone. So look, Ayaresafi is the best.
Thank you. Okay, so now that concludes our tour. We
Well,
have
but I still want to ask you
yes,
about this.
yes,
This very designs over there. It
yes,
speaks well of African heritage and
yeah.
so forth. So
We
why
have
did you have all these things over here?
so we have our Adinkra symbols on the wall because it is a part of our culture. Each one symbolizes something different, and this is our waiting area for the lab. Whilst
Yeah.
you are waiting on your lab results, you can sit here and have our powerful Adinkra symbols on top of you. So,
Wow, so amazing. So just
thank
in
you.
case somebody wants to help you to make this very big, because I know this is already big, but just somebody want to help you, what would you do? What would be your terms? What would you agree on?
Okay, so there's no really terms. Um, Anyone that feels like they want to donate, whether it's supplies, in-kind donations, money, we accept, and 100% of everything will definitely be utilized for this community. So we don't really have terms.
Well, you have a whole lot of friends, you have people that also follows you. What would you tell them to close this interview?
So I would just tell everyone that this is honestly a labor of love, trying to help the community with what we have, trying to give back to Africa and to Ghana specifically. And I think everyone, like all Black people, I feel like should aspire to help each other in some way.
Well, aside doing this video with you, I would like to have the opportunity to take a picture with you because you are my celebrity.
Oh,
You are doing something in a Ghanaian community. You are doing something in a community that I've been here before, that nobody has done that before, apart from you. So I would like to take a picture with you just to show that I've met my celebrity
oh,
who seems to be an African American and also doing a good job in Ghana.
thank
So
you.
maybe if you can permit me
Oh,
to take a picture
absolutely.
with you.
My honor. Yes.
Guys, as you are watching, you keep subscribing, you keep following. I think you guys should see what mom is doing. This Ayarisafie. Ayarisa means good health, right? Ayarisafie Healing Medical Center. These are our services. Well, if you want to contact her, if you want to support her, I think you guys need mobile money and so forth, right?
Yes.
Yeah, so remotely or whatever thing that you want to send, you can send it through this number. They will receive it because we need to help Africa, we need to help Ghana, we need to help the community. Well, maybe somebody wants to support you, just say it yourself. You have any social media, you have ways and means somebody can get in
Yes.
touch with you.
Okay. Yes, I do have social media. Right now, I'm not very active on it, but you can email me at Penny Zakia, which is my surname, my first name, Penny Zakia, Zakiya at gmail.com, and just get in touch with me if you just want to say hello, anything. I'm open to suggestions, criticism, ideas, everything. So just get in touch with me via email, and then we can go from there.
Well, do not criticize because she's doing the right thing. Do not criticize because she's doing the right thing. Just support her to do more, support her to expand this very beautiful health center and this very beautiful community. So as you are watching, you keep subscribing to our channel, you keep supporting her, and keep supporting her. I say what? Support her to rise up, to build Ghana, to build Africa to our liking. Africa, the key to the world. Bye bye.